Hi, my name is Haguyan. Today, I'll speak about universal health care. Health care coverage is very important for every individual. Everyone should have health coverage. People may think they are healthy and don't need health care coverage. However, anyone can get sick at any time. For example, nobody expected COVID-19 pandemic. It doesn't matter if you are healthy or not. You are exposed to sudden great danger. Without health coverage, you would be more nervous and scared of being exposed to COVID 19 than people who have medical coverage. Unfortunately, health care coverage in the United States is very expensive. If you're not employed or you are self employed, the health care coverage costs too much. We need an affordable health care that covers every citizen in the United States. In other words, we should have universal health care. The purpose of this speech is to convince you that the United States adopt universal health care. Currently, the health care in the US is private health insurance system. It relies on fee for service for private insurance. Under this system, doctors, hospitals, and healthcare professionals and businesses are free to charge whatever they want for their services. The fee for service create incentives for doctors to deliver more care, but not necessarily better care, because doctors are paid for every service they perform. They have an incentive to provide unnecessary medical tests and procedures. Under the current fee for service system, significant portion of population is uninsured. Nearly 28 million non-elderly Americans, or 8.5% of the entire population, were not insured in 2018. According to the most recent census, government passed Affordable Care Act, also known as Obamacare, to make health insurance more affordable. However, for many middle-class Americans, premium and deductibles are too expensive. Because of this burden, some people are dropping Obamacare even though they would have to pay a penalty. They are also impacted COVID-19 on the uninsured. Even though the government pays for testing for COVID-19, people are still free to get tested because without insurance, they'll have to pay for the treatment. Since the lockdown, 16 million Americans have lost their jobs. They'll likely lose their health insurance benefits soon. The US has the most expensive healthcare system in the world. In 2013, the USA spent the equivalent of $8,713 per person on health compared to the OECD average of $3,453. That's nearly a double what the other countries spend. The US spends by far the most on attractive costs. Due to its third-party pay system, there are many insurance companies that add administrative costs to the cost of medical care. In addition, we pay varying medical prices depending on insurance companies, which is always higher than other countries. Now, let me talk about what universal healthcare is. Universal healthcare is a system that provides medical services to all citizens with a single payer. The government controls the healthcare system. Most universal healthcare is funded mainly by taxes. The US is the only developed nation without universal health care. Benefits of universal health care is its owner's overall healthcare costs and administrative costs. Everyone has health insurance. Everyone will have access to quality and standardized treatment at low costs. The system will provide affordable preventive care. implement strict control of pricing and quality of medical services. It will result in healthier life for the general population and reduce social inequality. Today, I discuss why the United States should adopt universal health care. There is no perfect systems of health care. No matter how good a system is, there are problems with that system. Thus, there are problems with universal healthcare system as well, such as long lines at the hospitals. However, the universal healthcare will be more beneficial to the general US population than the current healthcare system. Lastly, I want to share a story from CNN. The title is A Nurse Revealed the Tragic Last Words of His Coronavirus Patient Who is Going to Pay for It. Derek Smith is RN who is predominantly treating COVID-19 patients at a hospital in New York City. He revealed the tragic last words of a dying man he was about to place on a ventilator. The patient asked Smith, "Who's going to pay for it?" In between his labor breaths, "This is our reality, a tragic reality."